Next is Dr. Stone, Assistant VP for Research at NIU, who is no stranger to the County Board, an integral part of our Public Health Advisory Board. And Doctor, good evening.
Good evening. Thank you for having me. I'm here to say a few words on behalf of the Public Health Advisory Committee about the planning efforts the Public Health Department has been undertaking that feed into the Quality of Kane 2040 plan. When I spoke at the board retreat back in the fall, I emphasized that public health is not the same thing as preventive medicine. I reminded us that we need to think about public health on its own terms. That is, we need to think about populations as whole communities, not collections of individual patients, waves, not particles. I talked about health promotion as being promotion of global well-being, not medical intervention. I talked about prevention as policy, systems, and environmental change, making the healthiest choices the easiest choices, not simply providing education and information and hoping for behavior change. And I talked about protection of populations, water quality, inspections, vaccination, bioterrorism preparedness as a critical line of defense. We tend to think of events like a devastating bird flu epidemic or a deadly salmonella outbreak as unlikely or unlikely to happen here in Kane County. But as soon as we think that, we remember that Kane County has only recently weathered the largest TB outbreak in the nation. It can happen here. A well-trained and well-integrated public health department is our county's defense against such assaults to our health and well-being. And I talked about savings, not costs. Money spent on public health is money saved for other things. In order to meet the public health needs of the county's population and to contribute to long-term countywide planning efforts, the department has been working closely with the Public Health Advisory Board on its community health assessment, its community health improvement plan, and its own strategic plan. We have been delighted to see how well the community-wide health data has been integrated with input from the community, the board, and the advisors, and used to drive the discussion about health priorities and initiatives for our county, as well as the development of initiatives for the strategic plan. This has been a data-driven process in the best sense of the term. We're also thrilled to see how the health priorities are dovetailing with the transportation and land use elements of the 2040 plan. This kind of countywide planning is cutting edge and shows the board's commitment to future generations of Kane County residents.
Thank you, Doctor.
With that, I thank you.